Hello, everyone. My name is Lisa Washington Thomas, and I am the branch chief for the Self-Sufficiency Branch in the Office of Family Assistance. And I just want to welcome you to OFA's webinar for this month, Building Social Capital for Families on Temporary Assistance for Needy Families and Other Low-Income Populations. And we'll be discussing the important role of community-based and faith-based organizations and partnerships. We're excited to have a panel of experts, one from Virginia's Pathways and the other from Future Foundations, who will discuss their programs. I am pleased also, again, to welcome you to this event, and I'm joined by my colleague, James Butler. He's also works for the Office of Family Assistance as a program specialist, and he will be facilitating today's webinar. Today's webinar is of particular interest to me because a few years ago we had a TANF and FBCO partnership initiative, and we highlighted two of these programs, Future Foundations and Pathways, out of St. Petersburg, Virginia, and found some great promising strategies of working with TANF clients, their children, and also helping those programs help to build social capital. We weren't calling it that back at that time, but now it has a new nomenclature. Given the most, so during today's webinar, we will talk about the recent focus on social capital and its networks to connect low-income individuals and families to pathways to employment with much-needed supportive services. Fostering economic mobility in the United States is a challenging pursuit, and research from economist Raj Chetty and his team at Harvard University shows that 70% of Americans going in the lowest quintiles will not move to the middle class. Many efforts to stop the cycle of poverty has focused on employment as the answer. However, TANF-eligible families need access to various forms of social capital and regular capital, but we need capital beyond economics to help move them out of poverty. These families benefit from access to trust-based networks that provide other types of resources, and we're calling that social capital. So social capital usually has two different ideas or focus. One is building the peer network of TANF recipients or other individuals who are in a particular cohort and helping them or facilitating an environment where they can help each other and move forward and encourage and support each other. The other part of social capital is helping individuals to broaden their social network so that they can apply for jobs that wouldn't necessarily be within their sphere of influence. So we'll be talking about both of those either today or in the near future. Now, FBCOs, community-based organizations, and faith-based organizations play a critical role in providing culturally sensitive social capital to TANF recipients and TANF-eligible families that create pathways out of poverty as they are embedded in the communities they serve. In this webinar, we'll hear from FBCOs that serve TANF-eligible families. These organizations foster trust with their clients and provide them with resources via their networks, resulting in access to supportive services such as child care, transportation, training programs, employment opportunities. I am so sorry about the phone. And also, but what most important, that secret sauce that helps encourage people to move forward, whether it's peers or their peers and other people in their community that can support them. In today's webinar, you'll gain insight to the important role of social capital in fostering economic stability and the mobility of low-income families. You'll learn about the role of FBCOs in providing social capital to families on TANF, and you'll identify principles and practices for providing social capital to low-income populations and better understanding of how community networks can provide a variety of supportive services resulting in increased access to employment and training opportunities. And finally, we'll explore examples of successful engagement with families on TANF and other low-income individuals and families. We are very fortunate to have two representatives, Juanita and Kadira, who will talk about this topic and will guide you through the conversation. Throughout the presentation, you have the opportunity to ask questions through the chat box in the bottom left-hand corner of your screen. We encourage you to ask questions, and if your questions are for a specific presenter or program, please be sure to specify that. If we do not get to everyone's questions today, when we will post the webinar slides. We will also post a Q&A that will appear on the Peer TA website, along with the transcript or audio recording of today's webinar. During the webinar, there will also be a series of polling questions that will appear on your screen. Please answer each by clicking on the radio button to select the response, or there will be one polling question where we'll be asking an open-ended question, so please respond accordingly. Thank you. Doing so will not only help us guide the discussion, but will also share additional information that may inform your practice. So without further ado, I'm going to turn this over to Mr. Butler, who will introduce our speakers. Thank you.
Thank you, Lisa, and good afternoon, everyone. And I am pleased to introduce our presenters for today's webinar. You will first hear from Juanita Epps, who serves as the CEO, Chief Executive Officer at Pathways in Virginia. Pathways is a community development corporation dedicated to rebuilding and strengthening Petersburg, Virginia, and the surrounding counties through an extensive and diverse network of partnerships that includes government entities, faith and community-based organizations, and profit businesses. And they seek to build pathways to education, employment, healthcare, and community. A little bit more about Juanita. She has been with the organization for over 13 years, and her work focuses on providing individuals with opportunities to address their barriers in ways that allow them to be competitive in the job market and or live productive lives. These individuals are usually high school dropouts, at or below the poverty level, uninsured or underinsured, and have various other barriers to success. Following Juanita, we will hear from Kadira Abdul Rahim, who serves as the Chief Executive Officer at Future Foundations in Atlanta, Georgia. And she has served in that capacity for over 12 years. Future Foundation is a community-based organization that works to level the playing field for youth by providing quality education, health, and life skills programs. The organization seeks to improve the life changes of youth through a 5-point wraparound strategy, which incorporates relationship skill development, academic enrichment, family supports, life skills building, and health education. Through Kadira's life experience, she has used what she's learned to alleviate poverty wherever possible, using the Future Foundation's program as a laboratory for innovation. Kadira has developed a theory of change to address how poverty can be disrupted and alleviated anywhere. By giving children access to family, education, health, relationship, and life skill support, creating what she calls a second family environment. So I will now turn the floor over to Juanita from Pathways. Juanita, you have the floor.
Good afternoon. I am glad to have the opportunity to share a bit about our organization and our work and some of the challenges that we continue to face and how we are working through them. So let me start by just giving you a little bit of background. Our moderator has given you some, but I want to give a little bit more, and throughout this, you'll get a much better sense of kind of the breadth of the work that we're doing now compared to what we were doing a few years back. We started this organization in 1994. Two Methodist ministers were given a charge, and that charge was, here's $500, go out and do something. And this charge was given to them by the United Methodist Church. In that effort, what they began to do is really to work with school-age children before school and after school, well, mainly after school and during the summers, really providing enrichment type activities for them. In 2001, then Petersburg Urban Ministries, now Pathways VA, received its first Youth Build grant and began to work with young people 16 to 24 who, as many of you may be aware, are young people who typically do not have high school credentials, and they have multiple other social barriers that they're experiencing that impede their success. Pathways has been working with this population since that time through HUD as well as through the Department of Labor for Youth Build programs. And we're really excited to really think of this program as our flagship program because it really allows us to touch on all of those points that impact an individual's growth and development. And one of the latest things that now has a name, but some of the practices that we've always used is trauma-informed care, something that we've been doing for years, but now many of you have probably heard of that through that tag of trauma-informed care. Some of the individuals or partners that we work through in order to get that work done with our young people are Petersburg Wellness Consortium, which is a consortium that that leverages or brings together all of the agencies, the local government, to really talk about what are the needs that this community has and how we can address those needs from a collaborative standpoint, as opposed to just trying to do everything in our own isolated worlds. We also do a lot of work with the Health Department, Freedom Support Center, the Crater Workforce Development Board, and the Department of Social Services and the faith-based community in order to make sure that we can meet the needs of these young people. We're also fortunate enough to be, in 2008, to have started free clinics. And those free clinics are available to individuals 18 and older who are uninsured or underinsured. And we started the clinic with a cardiology clinic. At that time, one of our board members was a cardiologist, and one of the things that he wanted was a free clinic in this space. So when we opened our new headquarters in 2008, that was something that was included. Since that time, those clinics have actually grown to include rheumatology, chronic care, women's health, psychiatry, dental care, disability screening, and breast health. It's really important to note that these clinics are all free. We are the only clinic in the state of Virginia that is truly a free clinic. There is no cost for any of the services that we provide for individuals who come to us for care. What else I want to tell you about this? In order to get this work done, some of the same entities that I mentioned earlier are entities that we associate with, but we also access pharmacy services through the Susie Fund, VCC, the Virginia Association of Free and Charitable Clinics funding, our physicians networks, and other partnerships that we have, to include the health department with community health workers who are providing additional services beyond just the health needs of our immediate health needs of our clinic patients, because we realize that health is extremely important for growth and development, but that's not the only thing that individuals need. The other area that we're working in these days, we started in 2016 providing what is called a financial opportunity center. And that center really allows for individuals in the community and the localities around us to be able to work on financial stability. We have individuals who come to us who have never seen a credit report, don't know how to read it, even if they had. and most of them don't know if they have or what their credit score is. We actually work with these individuals to understand that. We connect them with other benefits and services that might be available to them either on a local, state, or federal level, and also work with them from an employment standpoint, because we understand that at the end of the day, financial stability is based on income coming in. And so we look at what are those pieces that they need from an employment side in order to either improve where they are and get a better position in their job, and or to change jobs. What skills and abilities do they need to develop in order to improve their income so that they can, at the end of the day, improve their financial stability? We feel that all three of these programs, from the Youth Build program to the our free specialty clinic to financial stability, work towards our overall goal from our mission standpoint. And our mission is to provide pathways to employment and education, to good health, and to community revitalization. And we feel that these three things actually work together. So it's like those Venn diagrams that you'll see constantly overlapping. And all of these services, with the exception of Youth Build, are available to any participant or any individual in the local area. I will also state that the clinic services are services that we provide not just in the immediate Petersburg community. Our services extend from as far south as North Carolina, that we're providing healthcare services, to as far north as Northern Virginia. So a pretty broad base of individuals who have a need for healthcare. And next slide, if you would. Okay. As we look at how we're building the sense of social capital, one of the things in terms of looking at our community and faith-based networks, as part of the history and discussion on community partners, I touched on ways that our partnerships help us carry out our mission. What you see before you now are but a few of the broad ways in which that support happens. And so I want to talk a little bit about each of those areas. In terms of tutors and mentors for our Youth Build students, well, we really rely heavily on our faith-based community to provide that access. And when that happens, that means that our young people actually are not just getting the information that we provide inside the walls of the facility, but every person that they touch actually has a different network, and it really helps to expand their network and connect them to resources that we may not have a direct hand on. In terms of our doctors and nurses for our free specialty clinic, all of our doctors, our NPs, and our nurses are volunteers. So we have no paid medical staff to carry out all of the services that I talked about earlier. These doctors and nurses, I know that we only have 3 of them who are retired. The larger percentage of our doctors and nurses either work in private businesses or they work for local hospitals. We have one physician who, 2 physicians who come to us every Thursday from 12 o'clock to 1 o'clock to provide chronic care clinics. And they come from the local hospital next to us. They spend their lunch hour every Thursday providing care to individuals in our chronic care clinic. In terms of financial literacy workshop, these services are provided across the board, not just for our financial opportunity clients, but our Youth Build students, individuals who are coming to our clinic. They're provided by our local financial institutions, from credit unions to banks. They actually provide those services, and so that way, that's another avenue of making sure that people understand what their needs, how to access the services that they need. We have in the Financial Opportunity Center 2 full-time staff, one that works on employment and the other that works the financial coaching arena. But our reality is that our staff does not have all of the resources that they need. So they're reaching outside in order to provide those services and connect our participants to those services and those resources. That would also include the Cradle Workforce Center that has some resources, but Petersburg Works as a new pilot program is also one of those resources that helping to make sure that our young people and other clients are having access to the financial resources and information that they need. In terms of healthcare resources, I mentioned early Virginia Association of Free and Charitable Clinics that really provides a plethora of resources for us. But we also host forums and stuff for community members to gain as much information as they can on the resources that are available to them, while also working with individuals in our clinics to expand that in terms of working with neighboring clinics so that we don't provide everything, we're specialty. So we reach out to other resources to do that, especially when it comes to providing medication for our clients. And other supportive services that we connect with the Department of Social Services, as well as other agencies, especially Petersburg Wellness Consortium, to support our clients. And as I mentioned earlier, the community health worker, who is really about connecting our clients to various resources in the community beyond just health. Next slide. Okay. Some of the challenges that we've encountered. You see some of the few, that magic one at the bottom that says funding. As a nonprofit organization, it's always a challenge. However, I want to talk a little bit more about the other three. In terms of dental care, we are limited in the number of dental opportunities that we can provide to our clients. We are providing that service every other month, and we are only focused on individuals 65 and over because there is not a dental care benefit in Medicare. So we're providing that service. We can service as many as 20 individuals who come through for oral exams and screenings, and then those individuals are then going to Lucy Core Foundation to get any restorative work that they need. And these services are at no cost for them. We've been doing this project for about a year, and we have a waiting list, and we cannot keep up with the waiting list. That's a challenge, and we haven't yet figured out how to overcome that because this is a new service, and Medicare has not changed its dental benefit. So that is an ongoing challenge for us. And we do work with the Virginia Association for Oral Health. We're trying to work on legislation and policy to try to help make that change. We talked a little bit about social determinants of health, and what we're continuing to do to meet that is we look at the determinants for which we have some control over, in a sense. One of the things that we're doing is we provide fresh produce for our clinic patients in an area where we are considered to be a food desert. And that's every visit that they get, they're going to get fresh produce. The other thing that we're doing through our Youth Build program, we continue to do affordable housing because we do have a lot of leaded homes in our area, and we have a lot of blight. So we are working in conjunction with our Financial Opportunity Center to help move people towards putting themselves in a position where they can become homeowners, and working with some local agencies to help do the paperwork around getting them prepared for home ownership, while we are taking the opportunity to build affordable housing in conjunction with DHCD. In terms of staffing is a challenge, but my challenge has 3 prongs. One is I have my chief financial officer retired in March. That was a huge challenge to try to replace that individual, and that's something that's still going on. My COO took a higher paying job. We're nonprofit, went back into the for-profit industry in June, which created another major loss in terms of supportive staff in the administrative arm. But the other side of that is really finding the right people who have the heart for the work that we do. So that challenge is an ongoing challenge, and in a few minutes I'll talk a little bit more about how we're going to how we're working to overcome that. But it is a work in progress. And then once again, funding. As grant funding has become competition has become stiffer. We have worked really hard to improve our concept of being an island unto ourselves. We really work really hard to be more collaborative, but not just to be collaborative for the sake of being collaborative, but really about how we involve our partners. And that is really based on relationship to improve funding opportunities, but it's also about going after and working harder to improve individual donors. Next slide. Well, what have we learned? Staffing, once again, it's really hard to find. I'm not going to say it's hard to find the right people. I'm saying it's hard that when people come before you who are interested in working with, to really drill it down to making sure that we're finding the right people to do the work. So one of the things that we've done and that we're doing, and that is we're continuing to look at what are we asking people as we are, one, posting posting job opportunities, but also when we're interviewing people, what are we really asking them? Are we just asking them just the general stuff that really doesn't tell us about the heart of the person? And if so, then it's also about making changes there. So we have made some changes there, but that is still something that is something that we're still working with, because it's really important in our work to make sure that the people that we hire are really interested in the populations that we serve. And we want to engage earlier with our partners. I talked about the collaboration, but once again, not collaboration for the sake of collaborating, but how do we build relationships earlier on, and how do we maintain those relationships? And one of the things that I've done to help us in that area is hired a community outreach coordinator. Somebody who's out there just for the purpose of knowing who's out there, building the relationships, and then talking about how these relationships can help support the work that we're doing, which at the end of the day, how does it help support the community? And then we just need to be more persistent on exploring funding avenues. And once again, that's beyond just grants. I think it's that time where that happened for us. You know, in our previous 20 years, we were able to survive off of grants and do the work that we need to do. That is not the reality of today. So for us, it's really increasing our donor base, especially our individual donors, and looking at how we can expand that donor pool to be more of something that we're doing on a monthly basis. Okay. So lessons learned. Next slide. I'd like to talk to you about a young person who came to us in our Youth Build program. She's a young mom, very quiet, very reserved, not very outspoken, but who, through her experience with us within the Youth Build program, we were able to tap into some strengths that she already had, but because she was quiet, she wasn't really outgoing. So one of the things that we exposed her to a lot, everything from college visits to the Petersburg Works opportunity, where she had the opportunity to engage with other employers, to engage with agencies in and around the city to understand what the network was, what resources were out there. And when she graduated, with a 3.4 GPA for her high school diploma, she was very afraid to move forward. She was dependent on social services. And when we presented her with an opportunity to seek employment from one of our larger employers, she was very hesitant to do that. She was hesitant to give up the resources that she had access to. Over time, with conversations with the financial opportunities coach, to the resources at the Cradle Workforce Office, to Petersburg Works, to one of the counselors at the Department of Social Services, we were able to convince her to apply for the job. She got the job, and so she's now fully employed. She has a full-time employment with one of the largest employers in our area, which is Southside Regional Hospital, and she has full benefits. And she comes back and she talks to our students about how important it is to move outside of your fears and to understand the value of having your own and not being dependent on someone else to provide minimal resources for you when you can really expand your world. So that's Pathways. That's what we're doing. That's some of our struggles. We probably have others that I didn't mention today, but we're still moving forward and enjoying the collaboration that we have with entities, not just in our immediate community, but especially statewide and some of our federal partners. So thank you.
Thanks, Juanita. So very shortly, you should see our first polling question on the screen before you. And it reads, does your TANF program currently partner with community and faith-based organizations to create networks for supportive services for the TANF and low-income families? We'll give you a few moments to respond.
Good afternoon, Jace. This is Jeanette. The polling results so far is that currently the audience responded 57% have a partnership with FBOs or CBOs to create networks of supportive services, and 43% do not.
Thanks, everyone, for your participation and your responses. And so you will now hear from Kadira Abdul Rahim.
Good afternoon. At Future Foundation, our vision is to create a community where youth receive the support they need to become self-sufficient adults. And this vision was created by our founder, who was a student athlete who grew up in Atlanta and was a student athlete, and he's actually my brother. We were student athletes together, and we graduated from school here in Atlanta. We come from very, very, very humble beginnings, but as student athletes, we had a wonderful opportunity to go all the way from Atlanta to Cal Berkeley and get our undergraduate degree. But once we got there, we were completely unprepared to compete academically. And as a result, we had a very adverse experience. And during those experiences, my brother came to me and said, you know, if we ever have an opportunity, we should go back to Atlanta and create a place that not only helps children and students graduate from high school, but also supports them in getting to some type of post-secondary institution where they can make and earning a livable wage to be a self-sufficient adult. So in 2001, my brother moved back to Atlanta and started the work to launch Future Foundation. In 2004, we were organized and we launched our first direct service program, which was an after-school program with about 15 kids and a $200,000 budget focused primarily on providing those 15 kids with everything that they needed to stay in school. And we launched that work in 2004 with those 15 kids. But by 2010, we experienced a lot of growth and we were servicing 5,000 kids and families. And so we were able to grow primarily through a large infusion of government support from the Administration for Children and Families. So initially, we got some capacity building dollars. Those capacity building dollars really built our capacity and allowed us to compete for some health programming that complemented our after school programming. So we went from 15 kids in 2004 to by 2010 servicing 5,000 kids and families. Our budget was very close to $2 million. And we were servicing kids and families through 3 core programs. So that after school program grew significantly from 15 to 100 kids. We were doing an in-school program where we were going into the schools during the school day and teaching kids about healthy relationships and how to decrease risky behaviors. And then we were also doing parenting programming, supporting parents with their needs and trauma that was happening in the family, and also ensuring that they were employed. So as you can imagine, with that substantial rapid growth that Future Foundation experienced, by 2010, our infrastructure was completely strained. And we had to create a plan around how we were going to stabilize our infrastructure. So from about 2010 to 2015, we created a plan that says this is what we're going to do to stabilize our infrastructure. And a big part of that plan was reducing the amount of programming that we were participating in. So we actually decided to do away with the in-school programming, which was our largest program, and also our parenting program. And what we said we would do is our after-school program was our core program, and we would incorporate the parenting programming and the health programming, relationship messaging into our after-school programming. And so we reduced our programming really primarily to our one after-school program, which reduced the amount of people that we were servicing. And it gave us a real opportunity to look at what was most successful and what we could measure and say that we were making a real difference in. And so, since 2007 with our after school program, we've had 100% of our kids graduate high school and go on, and 99% have gone on to some post-secondary institution. And that's extremely substantial in our community, because when I started this work, the average high school graduation rate was around 52%. So we knew that our after school program, from a measurement perspective, was extremely impactful. And that's something that we wanted to focus on moving forward as an organization. And when I talk about infrastructure, what I mean is, did we have the HR staff or department to support our team? Did we have a marketing plan? So all of those kind of back office things that support programming, did we have a strong enough infrastructure to support all of that growth? And because of that rapid growth at the time, we did not. So we spent 5 years really building our infrastructure to support programming, which meant that those three programs that expanded our organization significantly got reduced to just one program. While we were stabilizing our infrastructure and thinking about our next 10 years of work and really focusing on this after school program, we did a pilot program. And we did this pilot program based on a Harvard study that came out, and I think it was mentioned earlier, Rod Chetty, who did the program around income mobility. And we looked at that study, and that study told us that Atlanta was one of the hardest places for kids to climb out of poverty. And so we said to ourselves, we're having a lot of success with the students that we're servicing day to day with this after school program, but we're looking around in the schools that those children are attending, and the community itself is not improving. So what kind of strategy can we create as an organization that would not only have an individual impact, but would also have a system level impact? So on the next slide, you can kind of see, our first 15 years of work, which was what we are calling at the time Future Foundation 1.0. And you'll see at the top of or under 1.0, it talks about 100% of seniors graduating high school and entering post-secondary institution. That was, our focus for the first 15 years of our work. How do we, work with schools? How do we work with children after school, during the school day, and their parents to ensure that they graduate high school and enter, some type of post-secondary institution? It was also during this time period that we developed this theory of change that said, in order for kids to climb out of poverty, they need access to 5 key things: health, relationships, family, academic, and life skills. And so, based on our results of these first 15 years with our 100% graduation rate, we know that, this theory of change is working. Yet the Harvard study said Atlanta is still the hardest place for kids to climb out of poverty. So we really challenged ourselves around how do we transform our organizations to ultimately transform our community. So we did a pilot in 2015, from 2015 and 2016, that said, this is what a new model could look like at Future Foundation. And we actually raised about $1 million to launch that model and implement it. And the model was very much focused on how do we create a system level change through collaboration. So it wouldn't just be Future Foundation anymore. It would be, how do we look around and work with the government, the business community, other nonprofits, and individuals who have resources that could help our children. And so we launched that pilot. The outcomes related to the pilot were very successful. So Future Foundation built a 2017 through 2019 strategic plan based on that, the new model. And so our work is completely transformed. And what we're focused on now is really using our after school programming, which, we feel is our core competency, which we've done throughout the history of the organization, using after school programming as a hub to coordinate the resources of individuals, the faith community, the business community, and the government community in low performing school feeder patterns. So, you have a middle school that feeds into a high school. And what we're seeing in our community is multiple feeder patterns that have been historically underperforming for 20 plus years. And so with this new model, you work with the middle schools and the high schools and the middle schools that feed into those high schools. And you use after school programming as a hub to coordinate all of these different resources that are available, but just quite honest, aren't coordinated. People don't know about them. And so we're using our program now to create this ecosystem of resources for kids and their families. And, for each of the different, we're in, I think, 4 different feeder patterns right now, 4 different school feeder patterns. We want to be able to grow the number of students that we serve in those feeder patterns. So there are about an average of 4,000 children in each of those feeder patterns. We want to get to 50%, servicing 50% of those students in those feeder patterns through this collaborative model. And we not only want to measure the high school graduation of the individual students, but we also want to measure how collaboratively we all are moving the needle on improving that high school graduation and post-secondary entry rate. So our work is really transforming from focusing on individual change to some type of system level change at the school and the community level. And so that has, been our work and what we've been focused on the last couple of years. So what it looks like every day is we operate 5 after-school program sites. And we have at this time about 450 students that we serve across those sites. We serve our students from 6th through 12th grade year round. And that means 10 months during the school year and 2 months during the summer. And we serve them from the 6th through the 12th grade. So we're talking about a high amount of dosage and a high amount of access to all of these resources and individuals that ultimately create this ecosystem and second family for our students. In 2017, or at the end of 2016, we actually received funding to do a research study on this model that we created as part of the pilot work. And so we are in year 2 of a randomized controlled trial that will ultimately help us from a research standpoint prove if the model that I'm sharing with you is valid. And it's also helping us from a process standpoint really fine tune the operations of this particular model so eventually we can scale. If you go to the next slide, I'll talk about some of the challenges that we've encountered. Through the previous presentation, it was really interesting to see some of those challenges because they do very much mirror the challenges encountered at Future Foundation. So earlier, I talked about our rapid growth due to the infusion of the government dollars, which really limited our infrastructure to support growth because the dollars were very highly restricted. And so we weren't able to reinvest in some of those back office supports that we needed as we were growing as an organization. So challenges that we've encountered definitely align with limited infrastructure, which then means that from a technology standpoint, as we were growing, as we were adding on more clients and trying to do evaluation and research, our technology was very limited. We were very limited from an automation standpoint. We didn't have a database. We were working out of Excel spreadsheets. And so really, we created a strategy centered around how do we create more efficient services for our communities, but our organization itself was not efficient because of our technology and infrastructure challenges. I mentioned the pilot that we did in 2015. We had a number of partners affiliated with that partnership and that pilot, and still today we do. We have, Fulton County Schools, which is the largest school system in the state of Georgia. There are a number of churches affiliated with our work, Impact Church, the City of College Park and East Point Recreation Departments, our health department, one of our state's largest health departments. There are a plethora of partnerships. But one of the things that we find that's a major challenge with all of our partnerships, how do we identify those strategic partnerships? Because what we're learning as we are building this collaborative model is that there's a readiness issue, and a readiness issue around what organizations and partnerships have the curriculum to actually deliver programming. Do organizations have the capabilities to collaboratively measure? And that is not necessarily just the nonprofit, it's also the government community, it's also the business community. And so we have been really working on what does it mean to have a strategic partnership. So that's definitely one of the challenges that we've encountered. And it's a big challenge because I think there is value in small and large organizations. Oftentimes those small, very grassroots organizations have amazing relationships on the ground, and it's important to include them in the collaborative work. However, again, they have very limited infrastructures as well and aren't necessarily capturing the necessary data to be sustainable and report out on the efficiencies that the collaboration is creating. So that's been a major challenge. And then I want to echo what the person said earlier from Pathways. Staffing is just ultimately a challenge, and it's a challenge on two ends. So as we have grown as an organization, clearly we're trying to build our infrastructure, introduce things that are a little bit more sophisticated, and you don't always have the capital necessarily to attract the talent that you need to introduce those different elements of activities into your organization. And so because of that, oftentimes it's hard to do change management work, and the team that you currently have really focusing on their development to come along with those activities is a huge challenge. And so talent management acquisition is probably one of our largest challenges within the last year. In fact, I'm committed and very much focused right now on providing professional development in a whole variety of different areas for our team, because at the end of the day, without our team, we can't accomplish our mission. And so that's a big area for us that we're focused on over the next couple of years as we try to roll out this very complex strategy. On the next slide, we're talking about lessons learned. There are about 80% of nonprofits in the US are under $1 million. Future Foundation has been able to grow and sustain our revenue at about a $2 million mark, which is, a substantial accomplishment. However, a lot of our revenue is from governmental entities, so local and federal. And if I had to do it all over again, I would hire a development director initially to help us focus on diversifying our revenue. The presenter earlier talked about really focusing on individual donors. It's a focus of ours, as well as the private foundation and corporate community, to help diversify our revenue so that we're a healthier organization and ultimately more sustainable. So I would definitely hire a development director again. I would work harder at diversifying our team. Future Foundation is located in East Point and College Park, Georgia. Both of those cities have historically had extremely high poverty rates, is a highly segregated cities. The majority of people in those cities are African American, and it's just been a rich history of generational poverty. And so it's been really hard to diversify our team from a race standpoint. And if I had to do it all over again, I would work very hard to diversify our team and ensure that we have a different mix of racial ethnicities as part of our team, because I think when you have those different elements, it fosters lower turnover. I think everybody grows in those environments, and it also, I think, fosters an environment for innovation. And so I would definitely work harder at diversifying our team. As I mentioned earlier, from 2004 to 2010, we grew substantially quickly. We also just rolled out a new strategy, and I'm learning that pace is so important when you're rolling out these growth strategies. And so I would just pace the organization at a slower rate when we're thinking about growing and when we're thinking about launching new initiatives, because they are, both of those elements from a growth standpoint, launching new initiatives are very disruptive. And you think you have, all the plans, and you think that people are ready, but when you get into the launch of the work, you start to kind of see a lot of the challenges that were unforeseen, and it prevents you from adjusting. And so if I had to do it all over again, I'd start a little bit slower each time. And then the last thing is assessing risk more strategically. It was very risky for our organization to transform our work, launch a new model, do something as complex as collaboration, and actually launch a research study to confirm if this model is working. And so while we raised a lot of money to kind of do the pilot work, to also launch the new strategy, some of the ideas related to the strategy, I mean, it's been very complex for, funders and people to understand. And so I think I would assess the risk of transforming our work to be more impactful a little bit more strategically and try to understand. And, you go through all of the interviews and stuff, and that's what you do as part of this work, and you can't foresee everything. But I do think, I would spend a lot more time trying to understand how people might respond to transforming an entirely new model for our organization and what that means. On the next slide, there is a success story. And so I'd love for you to meet Wanda Edwards in these pictures. Wanda Edwards is one of those 15 kids that we started off with in 2004, and she completely represents our vision of creating this community to become a self-sustainable adult. That picture at the top left is Shawanda when she was in our program as a 5th grader. The picture to the right with the graduation cap top right and the eyeshadow is Shawanda graduating from a community college. And then the picture at the bottom is Shawanda graduating from Georgia State University this summer. And so currently, Shawanda is working at United Way. I'm so excited. And I'm so excited because just like me, Shawanda is a first-generation college graduate who probably for the last 7 years, all throughout high school, all throughout college, worked with her family at McDonald's. And she's now at United Way, and probably her salary alone will support the expenses of her entire family. And so she is definitely on the path to becoming a self-sustainable adult and recognizing our vision. And so our work at Future Foundation is to replicate what we do so we can produce millions of Shawandas who will transform their communities and break the cycle of generational poverty. Thank you.
Thank you so much, Kadira. So in a couple of seconds, you will see our next polling question before you on the screen. It will read, what partnerships does your TANF program have in place that could be leveraged to support CBOs and FBOs in expanding and enhancing their networks? We'll give you a few moments to respond to that, and then Jeanette Herzig will talk about the responses that were submitted.
Steve, this is Jeanette. I don't see anything coming up on the responses.
Yes, attendees, please feel free to submit your information about your current partnerships into the chat box, and we can share with the rest of the group.
James, we do have some questions from the group. Should I start with those while we're waiting?
Yes, we can do that.
Does that make sense?
Yes.
Okay. One question. The first question is for Juanita. When you started talking about hiring an outreach coordinator, a question from the audience is: would this outreach coordinator, do you have that position as a full-time position? And could you explain a little bit more about their responsibilities?
Yes, the person is full-time because ultimately it really impacts, just as Kadira mentioned, it really impacts fund development. And so some of her responsibilities, and initially, and I'm going to say in her first year, because she's actually been in this position for about a year and a half. The first year was really about, because we were also going through a change from having founders who ran the organization who had retired to me coming into the role as the CEO. It was that was a component of it that needed to be, there was some work that we felt that we needed to do in terms of making sure that people knew who we were, that we were still here. So we looked at it almost as if it was a rebranding piece. So hiring the community outreach coordinator allowed us to get out into the community, not just in our immediate area, but really to expand more in more of the Metro Richmond area, which is a much larger space, because we needed people to understand, one, the services that we were providing, and what, at the end of the day, what that's going to mean in terms of resources coming in. So her main role was really about that rebranding and really educating the community at large on who we were, what we were providing. So we were really talking about building relationships. On the other side of that, we've actually since changed that title from a community outreach coordinator to a development officer. And our reason for changing that title is really about our next step. And so we've done the work getting out there, letting people know that we're here and what we're doing. But it also became, how do we now take this individual and begin to have that conversation around building donors? And as Kadira mentioned earlier as well, that's building those donors from a corporate standpoint to foundations we were already working with, but from corporations to individuals, and building that. And so how is she able to get out there and have those conversations and enter it in a space where the title didn't match her work? So mainly it's around development, but continuing to build those relationships, but using those anchored relationships to do that work. That means that she has a responsibility of building some of the internal structures around setting aside quarterly fundraising efforts, identifying what they are, and then also working on annual fundraising events, something that we had not had before. So we have one that we will be doing for the second year in April. So building those kind of things and making that work is kind of what her responsibilities have become. And it's ever changing. So.
All right. Thank you, Juanita. I have another question from the audience, and maybe we should move to the Q&A slide, Steve, from the poll, and then I'm going to turn it over to you, James. But I have two more questions from the audience here that's been posted. One is, I think it was you, Quadera, who talked about both speakers spoke about the importance of talent acquisition and the right staffing complements. You raised, I believe, Quadera, this is for you, that you had a very specific professional development plan now in place. Someone in the audience would want to know, is that something that you would be willing to share?
Yes. However, it is specific to our organization in that, so we base that professional development plan off of our evaluation results. So we have independent evaluators that come in and assess our programs, and we get a report that says we're doing good in this area and we have opportunities in this area. And so the professional development opportunities are based on the recommendations of the evaluator. In addition to that particular professional development plan, we also survey our team. What is it? What are the elements what are the professional development opportunities that they actually want to participate in? And so we look at that data and incorporate those activities into our plan. And then the third piece is really focused on organizational assessment. So what does our workforce look like? All the way from how many people are kind of entering the workforce for the first time, all the way down to the racial profile of our organization. And so the third piece and component of our professional development plan is kind of focused on this fact that, 98% of our team is African American, and we want to educate them on what's happening with racial diversity and inclusion within the field, and how that will impact their work moving forward. And so we have those kind of three elements that have built out our professional development plan. So it's very unique to our organization, but I'm happy to share. And also, I think you can take what I've said too and perhaps craft a plan for your organization. But I think professional development is very unique to what is actually happening within your organization real time.
Can I also respond to that question, Jeanette?
Absolutely.
Yes. That professional development was an area that we also looked at and realized that for two reasons. One is it is very rare to find dollars to support staff development. Knowing that, one of the things we did intentionally, first Friday of every month, we decided, and we've been doing this for well over a year, we decided to do staff development. And so the first hour and a half of our day on the first Friday of each month is designated for that. Some of that staff development is external, which means we bring somebody in. Unfortunately, we haven't had to come out of pocket for any of that. But some of it is also done internally. So we have engaged in surveying our staff, just as Kadira mentioned, to find out what are their needs, but also survey to say what talents and skills do you have, as we've talked about where we are and the struggles that we're having or the challenges that we're having. What do you have that you can bring to the table that you would like to do a professional development on for the staff? And we have found that the staff development is hugely important. It is something that our staff looks forward to, and we give them that opportunity to give us feedback on it. But once again, at the same time, give them the opportunity to tell us what it is that they need, and not just always say, this is what you need, which is the same approach that we take with the community in which we work in. It's not about us coming in and saying that this is what you need. It's about them telling us what we need. So we also have that same practice with our staff.
Great, thank you. One more question has come in for Quadera. Quadera, given the ages of the students that you're working with, have you been successful in getting internships or summer employment opportunities with employers? Are they part of your collaborative?
They are part of our collaborative. I would say not in a huge way. Future Foundation is our largest internship provider. So one of the things that we have historically focused on is how do we provide internship and job opportunities for our students across our sites. And the reason why we don't have a robust program is because we don't have the funding to coordinate those activities. And I know that if we had one dedicated person to focus on those activities, it would be a very, very robust program, because we do have, as I mentioned earlier, this new strategy focused on involving the business community with our work. We've been able to place some of our kids in internship opportunities and actual jobs once they have graduated. However, because we don't have that full-time person that can focus on an employment program, it is not robust at this time.
Okay, thank you very much. Okay, one more question just came in. Are your programs looking at vocational schooling and apprenticeship program opportunities in addition to college? Maybe Juanita, can you start with that, or?
Sure. Oh yes, oh yes, oh yes. Yeah, it's for us. It's really meeting our young people where they are, and also recognizing, based on some other work that we're doing with them, what are their areas of interest and what would be the best thing for them, especially with our youthville students. We're in terms of the vocational training that we're providing them, we do construction, healthcare, and logistics. And so we look in those industries based on the students who are in those vocational tracks and give them exposure to those areas. So then we have currently, for this class that we're graduating in December, we actually have 3 students who are going on to college, 2 who are going on to 4-year college, 1 that's going to community college, but the larger percentage of our young people are entering the workforce, and probably 50% of those are entering the workforce for the first time. There are also individuals who are entering healthcare, and so they're looking at the opportunity to either do community college as an initial, and then moving on from there to do additional work. In terms of individuals who come through our Financial Opportunity Center, many of them are coming, they are not 18-year-olds, they're not individuals who this is their first time in the workforce. So what they're looking at may be a little bit different. We do have individuals there. We've had at least 2 individuals in that program who've gone on to college, but most of them are actually looking for additional training in some other venue other than going off to college. So they're looking for more short-term programs. So yeah, so we look at all opportunities: college, trade school, and apprenticeships.
Right. Qadera,
And,
will you
and
also
Future,
answer that?
and Future Foundation does the same. Our focus is we want, and to date we've had about 99% of our kids go on to all of those different post-secondary opportunities. The majority of our kids do either go to a 4-year or 2-year university, but our focus is we want you to be placed in something productive after high school. So we focus on military, etc. So that is our focus area. And then I just wanted to add, when we did our pilot program for the collaborative model, we actually had a very robust job placement program, and it was in partnership with our local youth labor department, who had DOL funding to do so, but there was some legislation that changed the demographic of students that the youth Department of Labor locally here could focus on. And so that changed the dynamics of our partnership and job placement significantly. So that particular legislation said that I think it was 80 to 90% of their funding had to be focused on out-of-school youth, which our demographic is completely focused on in-school youth, the majority of school youth.
Right. Okay, one more question just came in. As a state staff, because many of those much of the audience are state TANF agencies. As a state staffer, how can we support the connection between our TANF contracting agencies and programs like described today? Qadera, you want to start with that one?
I will add that Future Foundation has received TANF funding since 2005. So we've had a very, very, very close relationship with our state TANF office. And it's been a very rich and robust relationship. And I've seen over time how TANF has changed from not just being a funding opportunity, but also supporting the organizations from a capacity building standpoint. So our TANF, our state TANF office also offers our organization professional development opportunities. And I think that is a great way to continue building the relationship. So it's become, for me as an organization, less transactional and more of we are in this together. And so really looking at providing those professional development opportunities and capacity building supports for the organizations. And, you know, that's how I've seen our relationship grow. And I think that's how it can grow in the future.
Can I ask one follow-up question, Cordera? This is just me, Jeanette. How did that relationship start in 2005?
And I guess
that might help the audience.
Yes, and I guess this adds to the last question. I think we were at a resource fair. And we were either at a resource fair or I was at a meeting with TANF providers, which ultimately is a resource fair. And both organizations, Future Foundation and the TANF agency, we were talking about our work, and there were definite commonalities, and that's how the relationship has started really and thrived. And our local office has been a great supporter. We also serve together on some local committees like after school programming. I'm able to hear TANF plans. I think they're able to hear Future Foundation plans, which is really, really important. And I think as funding streams come out and departmental plans occur, I think some of that information is taken into account. So resource fairs, collaborative planning meetings, and just I think really being involved on the ground with whatever is happening from a planning perspective regionally at meetings. I think it's important for the government TANF offices to be there. I am a huge fan of collaboration and multi-sector work. So I'm sure whatever regions people are in, there's a United Way. There's some type of entity in that region who is doing regional collaboration work. And I just say that those TANF offices need to be part of that work. And really that's how our relationships have grown with our local and state TANF office, because of these kind of regional initiatives that are happening where there are multiple sector stakeholders at the table planning and working together around how we are going to improve poverty within our community.
Great, very helpful, thank you.
Yeah.
Juanita, how about you as a response to the TANF question?
I want to ditto the need to have TANF programs really more a part of what's happening in the community. And I know that in our community, the Department of Social Services may be at the table, but those who are involved on the TANF side are not the ones at the table. So how do you make sure that the entities, for instance, our Petersburg Wellness Consortium is an excellent place that that TANF individuals can actually come to actually present programming or opportunities, because that's what that collaborative space is about, so that we all know what's happening everywhere and to see where we can come together to make things better for the community. So I would suggest that that's one area that from the national level to be able to reach to the local level is really to push them more out and into the community. But that may be a conversation in our community with our new Department of Social Services. I'm trying to think what that individual director, who's actually only been in this job for less than a month. So So that may be a part of that conversation, is making sure that they're at the table, not just at government tables, that they are at the community tables and that they're engaging with us there. I also have to say that historically, we have been able to work with young people who come through our youth build programs that are TANF recipients. We have a relationship with their case managers. So we're working collaboratively there, but that's just with a young person who's already in our program and not really looking at the TANF program at large.
All right, thank you. One more question. Out of both programs, do you provide any services for the parents of the children, either for educational services to the parents or other supportive services or parenting services?
Future Foundation absolutely does, is part of our model. And in fact, we focus on educating parents. So we do parent workshops monthly. And those workshops take on a variety of topics. So at our research site, there's a curriculum that we follow as part of our parent workshops. And then at our, what we call our legacy sites, we focus completely on how to become an advocate for your child as it relates to institutions and your family. And then we also focus on navigating the school system, and we focus on generic basic parenting skills. How do you understand your adolescent, because the middle and the high school years are highly emotional. And so we want to educate our parents on that. And then the last one is we educate our parents on the risky behaviors that are out there. The cities that we operate in have some of the highest STD and HIV rates in the nation. And so we educate our parents on that fact so that they know how to talk with their youth about risky behaviors. And so those are some of the things that we focus on from a parenting perspective.
With Pathways, one of the other reasons for having the Financial Opportunity Center is because our youth build program is designed for 16 to 24-year-olds. So in order to support the parenting side, we have communications with the school engagement officers in the Petersburg area. And so they're connecting the parents within the community at large for those individuals that they're working with in the school systems. Those parents are being connected to the Financial Opportunity Center to get some of the similar type services that we're providing to our youth build students, who we have from 8:30 to 3:30 Monday through Thursday for anywhere from a 9 to 12-month period, and then through follow-up. But our youth are actually getting those parenting services because we have quite a few young people who are parents themselves. So we're providing those resources that they need from parenting, and usually through other partnerships and having workshops, seminars, the mentorship pieces to help work on parenting issues.
Well, thank you. With that, James, I'm going to turn it over to you. I know we might have a few minutes left for closing remarks.
Yes, thanks, Jeanette. Yes, and so just as a reminder, if you still like to submit a question, you may do so by entering that question in the chat box using the chat box feature, which should be located in your lower right-hand corner of your screen. And if your question is for a specific presenter, you can indicate that in your submission. So as we move towards to wrap up, I'd like to thank everyone who participated in today's webinar. A special thanks again to Juanita and Kadira for sharing with us today. Please remember to provide your feedback on this webinar using the survey that will appear in a separate pop-up window when the webinar ends. Another reminder, as we mentioned in the beginning of the webinar, a transcript and audio recording of the webinar will be available on the PRTA Network website. That website link will show up on the screen for you shortly. We'd also like you to hear from you about any future webinar topics that you'd like to hear about. And you can send those ideas to us through our peer TA at icf.com website. You can also expand our network and reach a greater number of people by directing any interested colleagues that you may know of from your local and state networks and agencies to our website as well. So before we sign off, were there any final questions, Jeanette? No?
No, I do not see any other questions that have come in, unless I'm missing something, Steve.
Not a problem at all. Okay, so thanks again, everyone. We appreciate your joining us today, and this concludes our webinar for today. Everyone, enjoy the remainder of your day. Thank you so much.
Thank you.